First one is a vegan diet is better for weight loss than the carnivore diet.
No, and it goes back to the Public Health Collaborative statement. So when they compare vegan to carnivore, there is no comparison. So for those who are not sure about that, I would just search Public Health Collaborative infographics. The low carb diet, carnivore is a form of that, is not even close. You're getting rid of the thing that causes insulin spikes, which is insulin is the fat storage hormone. So if you have too much insulin, the macronutrient that raises the insulin the most is the carb. So it's fairly logical. The organizations that measure which diet is best, they always rate keto as number one. They just had concerns about keto. They know keto is the best diet or one that's like carnivore-ish.
A vegan diet is more nutritionally balanced than a carnivore diet.
No, because you have essential amino acids and essential fatty acids that come from an animal-based diet. There's no essential carbs. So if your only diet is a plant-based diet, you're going to automatically have those deficiencies that were mentioned before, the vitamin Ds, the omega-3s, the zincs, the iron. So there's a little bit more work to be done with a plant-based diet. And again, you can get an expert in front of you that'll help you, but most of my patients don't have the resources to do that. So a animal-based diet gives you essential nutrients where a plant-based diet only focuses on the non-essential nutrients.
A vegan diet is a more human-appropriate diet than carnivore.
Again, ethics come in, right? I think a regenerative farming practice is very ethical. You let the animal live a full life, but I mean a pretty decent life. They graze, they help take care of the ground. We put the carbon back into the ground. I think that's ethical. I do like humans more. So if I can have a dietary pattern that allows humans to thrive, that's what I'm gonna lean towards, while recognizing that in order to have life, you have to have death, and that's okay. We just make sure that while we're on the planet, we honor the food that we consume. And I would argue that a hunter honors their meat way more than a person who's going to the grocery store. They understand where it came from. They maybe even raise the animal that they are going to consume for nutrition. So I would argue they get it more. I think people should check out Diana Rogers and her documentary that talked about this, because I think Sacred Cow, because I think that when you understand the science a little bit better, I think you'll do a little bit better.
A vegan diet is low cholesterol, so it's better for your heart health than eating meat.
If I was concerned about cholesterol, I would agree with that statement, but I'm not concerned about cholesterol. In fact, when you just search what is the cholesterol, it's going to include the good and the bad and the ugly. So the cholesterol number means nothing. The LDL cholesterol, which we worry about the most, is not to be worried about because it's a poor predictor of heart disease. The total cholesterol and the LDL, if that's the baseline, your blood pressure is twice as predictive of future heart disease. And the even better test is a fasting insulin, which is 6.7 times more predictive of a future heart attack. The gold standard is a heart scan. So if you're worried about your risk for heart disease, get a calcium heart scan. That'll be more predictive than cholesterol will ever be. Therefore, if I'm plant-based and I'm focused on that, I get it, but you're focused on the wrong thing. And that's why that's the biggest argument they make. It's going to raise your LDL, your cholesterol. Well, it doesn't matter. And if I do care, I'm going to do particle size. I'm going to do a LDL small and large particle comparison. I'm going to look at the ApoB to A ratio. And when you do a low carb diet, which is carnivore, the metabolic measures get better. In fact, your ApoB to A ratio gets worse with plant-based. It gets worse. Your triglycerides and HDL ratio gets worse. So, and if that's the better measure of heart disease than the total cholesterol and the LDL, then I would prefer to be metabolically healthy and have a dietary pattern that achieves that.
A vegan diet has a lower cancer risk than a carnivore diet.
So, this is the deal. If you look at the studies that were done that suggest that a animal-based diet was a risk factor for cancer, it's all observational. And we can end that question with that.
A vegan diet is better for the planet than a carnivore diet.
I think that a dietary pattern that's good for humans is the best diet, number one. And as humans with a big brain, we're able to then take that information and say, how can we honor the planet? how can we honor the people who maybe they have a religion where they can't eat a cow. Maybe they worship a cow, like Hindus, right? So if that's so we need to be in a on a planet where we're rational and we understand that there may be different, if you go to certain parts of India, then a plant-based diet is more of the standard than maybe in other parts of the world. So we're going to honor that. What we're not going to do is make these bold statements that the only way to heal is to be plant-based. And again, we've seen, and I'll always remember again when I did a video about the blue zones, everybody in the blue zones eats meat or fish. So let's stop this nonsense. Let's recognize that people in Hong Kong, they live, longer than anybody, and they eat the equivalent of 2 steaks per person per day. There are multiple ways to achieve optimal health. We're just saying to the world that carnivore should be on that list. And then as people are trying to achieve that goal, we're here to help them. And for those who want to stay plant-based, have at it. Because like I said, vegans and carnivores should be able to live in harmony, but we're not going to live in a world where we tell people what to eat because we think that's the best way to eat. We're going to live in a country where we give people choice.
Did you struggle with any side effects, any health concerns because of the vegan diet? Because you were vegan for 8 years.
8 years. And shout out to my wife for tolerating me.
Was she vegan with you?
But it was more vegan and vegetarians. I just want to say that first. And I did it because and even my patients, my God, they would come in and they were trying to do their thing. But for me, it was more staying bloated, having gas,
Mm.
uh, having that irritability. But I think about this in a broader context, which is the big picture. And what I found is that the vegan diet is it has a lot of hidden side effects that we don't think about. And most of that is related to nutrient deficiencies, right? And when you're nutrient deficient, your risk for cancer is higher, your risk for stroke is higher, your risk for breaking your bones are higher, because of that vitamin D. Your risk for, just not thriving in general, your risk for hair loss, being
Yeah.
depressed. So all of these things are hidden side effects. So for me, the real issue is how do I deal with the potential deficiencies? I can be very smart and have all the information about what I need to worry about. In the community I serve on the south side of Chicago, that's very difficult for them to have a well-formulated vegan diet and be successful. So I'm going to still worry about B12 deficiencies. I'm going to still worry about vitamin D and omega-3 deficiency. And I see so many vegans come into my clinic who are iron deficient. So what I tell my patients is the following. Can you get most of the nutrients you need in a plant-based diet if it's well done? The answer is yes. If I'm thinking about B12, can I get enough B12 from mushrooms and nutritional yeast? Of course I can. But is it better to come from fish and red meat and eggs? Of course it is. Can I get vitamin D from mushrooms and algae and things like that? Of course I can, but is it better to get it from fish and egg yolks and beef liver? Of course it is. And even now we know vitamin D needs to come with K12. So if I'm going to do vitamin D, I need the K, and I call K12 the usher to kind of usher me from my arteries, which can clog my arteries, that calcium, and that the joint, so I won't get arthritis. So the vitamin D will help you absorb the calcium, but it's the K2's job to then usher it into your bones. Well, guess where you get K2? You get it from animal source meat. You can get it a little bit from fermented foods, so you can get it that way, but it's not really optimal. I also think about my vision. I did have LASIK, so I cheated a little bit, Bella, and had LASIK. But I think about vitamin A, and yes, I can get vitamin A from plants. I can. But vitamin A gives us beta carotene,
Mm.
and beta carotene has to be converted to vitamin A. And there's only about a one out of, maybe 1 out of 12% conversion rate.
Right.
So to get the active form of vitamin A, it's going to be a little harder. So there's so many nutritional things, rather so, omega-3, same story. The plants have this ALA type of omega.
Hmm.
We need the DHA and the EPA, and only about 5 to 10% of the plant omega is going to convert to the form we need. Same thing with iron. If we're iron deficient, and then we are getting a source of iron that's not as readily available, like non-heme, we need the heme iron from meat, which will be more available to the body so that I won't have to take twice as much iron to get to the RDA, which is still not enough. So what I find is that when I think about myself and my patients, why would I go down that rabbit hole when I can just eat a steak that has all of this good stuff in it? That's all I'm saying. So to me, it's like if I had a population that was able to do this and they really had good reason to do it, I absolutely think that's fine. But if you're going to look at the population as a whole, I think we do much better by giving them the essential amino acids and fatty acids you see in animal foods so that they won't have to worry about all of these details. The only thing I even think about is I may take omega-3 because I don't eat as much fish. I may take I periodically I will take maybe some type of mineral or maybe magnesium, potassium, sodium, because with this dietary pattern you may lose those electrolytes. But for the most part, I don't really think about it. But you have to think about it if you're plant-based, and that's why I think this is a better dietary approach when it comes to carnivore and keto.